Okay, so that's, I mean, that's what we're showing, a real human side to the actual medical profession.
Yeah. When it comes to medical professions, and I did do a video about this, about suicide awareness, and it does come close to home. It hits close to home, where the highest suicide rates are first dentists, but then doctors, and followed by even psychiatrists, psychologists. And of course after that, emergency workers like ambulance workers, policemen, and firefighters, etc. And you just I try to humanize that fact that not that many people notice that the smiling doctor that greets you and treats your ailments are also the same people that are struggling and in need of, in a sense, medical care and treatment. So I try to make aware of the fact that these so-called, not so-called, but they are heroes. They also have a human aspect to them. They are flawed. They may be in depression, and I try to make the public aware of this.
And going back to QP itself, obviously as a business, you are. When many people claim to have an understanding of the medical community, one could view this as a reflection of your understanding. You are writing a piece of fiction that, in a way, shows what it's like to be a doctor, what it's like to be a medical student.
Yeah, this is true.
Do you believe this adds maybe a dimension of quality to your product?
Definitely. I don't like. Obviously, we all love Hollywood, but the parts of Hollywood I don't like is where it's a bit fake. For example, if I look at, say, I love House MD, but if I were to look at House MD and some of these doctors and their diagnosis and how they...
Of course, because nobody can diagnose just off the bat.
Of course, but then on the same note, you don't attempt different therapies without enough understanding and cause the patient to almost die multiple times before you figure out and save them. So how I wrote my novel is I try to make it a balance of spy fiction as well as real medical insight, where it doesn't take, say, a week to diagnose a patient. We get to a diagnosis in a matter of half an hour at the most, if not an hour. And it's very realistic. There's definitely good differentials. We have good choices that it could be, but at the end of the day, there is only one diagnosis, and we come to it fairly quickly and save the patient before attempting treatment. So that's how I wrote the novel.